Hi, everyone, and good evening. Thank you to all of you who are joining us here today from across the world. Thank you especially to our speakers from Geneva and California who are joining us at fairly challenging hours on their end. Had the chance to meet yet. My name is Angel Tay. I'm Associate Director, Policy and Health Finance here at Apple, the facilitator for the session today. As we know, the Asia Pacific region has made tremendous progress towards elimination over the past 2 decades. Yet, even as we celebrate the successes of our fight against malaria, progress has also prompted the need about how we can ensure the long-term success of malaria responses, especially in the context of reduced funding from external donors. About 67% of the total expenditure on malaria control and elimination globally is funded by international donors, including the Global Fund. In a number of lower and middle income countries in Asia Pacific, this contribution is as high as 90%. As a result of reductions in global health funding in the context of COVID-19 and macroeconomic forces such as inflation and currency depreciation, many countries are struggling to sustain malaria financing. However, ensuring the ability of an effective and efficient malaria program that is embedded in strong national health systems will be key. Without adequate planning, the lack of sustainable financing will disrupt essential program activities and risk the resurgence of malaria, reversing the gains we have made in the past decade and undermining progress towards elimination. Today, we'll be hearing from the Global Fund on their view of sustainable financing for malaria, especially in the Asia Pacific as well as the Malaria Elimination Initiative, MEI for short, at the University of California, San Francisco, on past and ongoing sustainability and budget advocacy support they have provided to countries across Asia Pacific through their Sustain tool. MEI in particular has been an important partner to APMENxChange, especially as we're working together to support the national programs of Cambodia, and soon to be Indonesia on their sustainability planning efforts. We'll also hear from Sri Lanka and the Philippines on their experiences with as countries that has undergone and is preparing for transitions funding with the Global Fund respectively. We'll then come back together for a joint Q&A session at the end, where we'll look all of you and any questions you might have for our speakers here today. As you can see on the mechanics on this slide here, we'll type your questions in the Q&A box on the Zoom functions here below. If you are able to, you can name the speakers you want to address your question to, and you can question by clicking the thumbs up button on the box. Without further ado, please allow me to introduce Matthew McGregor, Deputy Head Health Finance within the Health Finance Department at the Global Fund. Matthew joined the Global Fund in 2014 as Fund Portfolio Manager, and then spent about 5 years helping to operationalize and implement the Global Fund's sustainability, transitions, and co-financing policy. Prior to joining the Global Fund, Matthew worked in a variety of roles in health and development, including for 5 years as the executive director of a US-based NGO. Matthew, over to you.
Thanks so much, Angel, and so wonderful to be here. I think you said it at the beginning that it's so important to have this discussion because the region has made so much progress when it comes to control, elimination, and even sustaining elimination of malaria. And the challenge before us, and I think the challenge for everyone, is to think about how we sustain that long term in the context of significant macroeconomic challenges, lots of pressures on country governments, and here with great partners like APMENxChange, UCSF, countries themselves about this important topic, especially as we think about the next funding cycle and all the work that needs to be done. So let me share. I'll be relatively brief in my remarks, but what I wanted to do was a little bit about the Global Fund approach to this area. Can you see them, Angel? Just give me a heads up. Yes, perfect. A little bit about the Global Fund's approach to sustainability and a little bit of some of the key themes that I'm thinking about as we prepare for this new funding cycle. So first, as I mentioned, I just want a second, because while we've made enormous progress when it comes to, I think we have to be honest and recognize the challenges that are coming. There is a lot of pressure that both the Global Fund and countries, communities, CSOs, all involved in malaria responses are going to face. On the Global Fund side, we have a super ambitious strategy, trying to achieve even more than we have in the past, and doing that with, to some extent, sources. We know that countries are facing unprecedented fiscal pressure, that in some places is putting pressure on prioritization of health spend, certainly in the cost of essential services, all of which really combines to mean we need to be even better with resources that we currently have, and we're going to have a lot of work to do to raise additional resources for both health systems and national responses. I don't like that to scare us, but I think we have to be honest about the challenge we're facing, because the themes that we're talking about today have become even more important. And this is why the new Global Fund strategy places health financing, sustainable financing, and sustainability more prominently than ever before. Where we recognize that if we are not able to mobilize increased resource from a perspective of additional resources for health systems and responses, but also from a perspective of optimizing the use of the resources that we have, we're not going to be able to guess. And so we have to make this as prominent as possible in all the work that we do. As part of this, and as part of the new strategy operations for the new cycle, our sustainability transition and co-financing policy remains one of the most important we can leverage to keep this discussion high on the agenda of countries and of ourselves. As many of you might know, the Global Fund's sustainability transition and co-financing policy was passed back in 2016. And it was really a commitment from the Global Fund at that time to work closely with countries, work closely with implementers, closely with communities and CSOs to strengthen the sustainability of our investment and of the national responses. And it remains just as important. If you think about all of the things I just mentioned around fiscal pressures and macroeconomic challenges, these are important. And there's really 5 or 6 areas that that policy says we need to focus on. The first is making sure we strengthen co-financing and domestic financing of the national responses and health systems. Countries look at the allocation letters they recently received from the Global Fund, you're going to see a huge emphasis on thinking about how we make strong, targeted, strategic co-financing commitments. And this is one of the key pieces of what we can do to put a focus on financial sustainability. There's also a strong emphasis in the policy around country-owned, multi-stakeholder transition and sustainability planning, which in many ways the region has been at the forefront of. And keeping that going as we think about the new cycle is going to be critical. The policy also asks us to be very clear that it's hard to think about sustainability without emphasizing strategic investments in resilient and sustainable systems for health, and including pushing all of us to move toward elimination in a more integrated manner. Health systems are the foundation of the national responses, and we need to be thinking even more about how we can make the right investments to strengthen those systems and or to align with them. It also pushes us really heavily to think about value for money and efficiency. There is just no way we are going to be able to raise, as we probably have in the past, additional resources for these responses, which means doubling down on discussions at the country level about efficiency, about value for money will be critical as we move to the next cycle. And then finally, making sure that we continue a focus on the most vulnerable populations, the hardest to reach populations, is critical. Why? Because we've often seen those populations first to really face challenges when it comes to sustaining responses with less external resources. So I'm going to dive into 3 of those themes in a little bit more detail, but I just want to throw them out there because I think as we think about the new funding cycle, as we read the allocation letters and think about country dialogue, we need to keep a focus on all 5 of those. The funding requests that countries will soon be filling out, I have a specific section on sustainability and enhancing domestic financing. So this theme has remained prominent in everything the Global Fund is. I want to hit a little bit more specifically on 3 of these themes that I think are really important for us to stay focused on. The first one is around co-financing. Now, co-financing for the Global Fund is probably our most direct lever where we can leverage our grants to push countries and work with countries to invest in responses. What we want to achieve with co-financing is both raising additional resources for health and the national responses, as well as working with countries to absorb those interventions that are dependent or heavily financed. Angel talked about at the beginning about some of the reliance in certain countries on the Global Fund for certain interventions. And so what we want to achieve with co-financing is really raising additional resources overall, but also looking at those areas that continue to have heavy support from the Global Fund and see how we can move away from them in a gradual phased manner. This is really a fantastic opportunity we can have to discuss with the right people and about the right programmatic areas. And as we think about 2023, 2025, there's a few things I think front and center. The first one is really ensuring that our commitments in the next cycle are strategically focused, incredibly strongly linked to programmatic objectives. Know that one of the most important things we need to do is say, strengthen the national financing of HRH and health workers in particular provinces, making sure that any co-financing commitments that we have are incredibly linked to that programmatic objective is key. We also need to make sure that these co-financing commitments are realistic. They're aligned with the fiscal space in the countries and the challenges countries are facing. And they also come with clear, strong, coherent data to back them up. While the policy has been very helpful in starting this conversation at the national level, we could see some improvements in the quality, the consistency we receive to back these commitments up. Co-financing will be a country-specific discussion. So there's no way I can say, here is the most important piece of it. But I wanted to offer one specific example. If you look across the region, there are a number of places where the fund heavily finances service delivery, and a big part of that is the procurement of health products. And so you still see some countries pretty dependent, even in advanced stages of their national responses, on the procurement of health products. And making sure we leverage discussions around co-financing to shift those dependencies, not just from a financial perspective, but also from a procurement capacity perspective, from a supply chain perspective, so we can get the right health products at the right price and in high quality, is one example of how this policy can be used. The second thing I wanted to touch on was value for money. As I mentioned, there are really significant pressures on raising additional resources. And while we should continue to have that conversation at the national level, we're going to have to put more on securing the lowest prices for quality inputs needed for service delivery, allocated in the right way, in the right interventions, in the right places, and targeted in the manner that we can maximize the impact of the resource envelope that we have. So that heavy focus on value for money is a theme that is prominent in our strategy. It's prominent in funding requests. Again, this is going to mean so many different things at individual country levels, but I did want to offer one example, and that would be around the shift away from some of our vertical toward more of an integrated approach, particularly when it comes to community health workers. We all know, I think, here, community health workers play in many places a critical role in strengthening national programs and overall service coverage. And we've seen how important they are for the region. We've also seen areas where we could do better in terms of integrating and those health workers in a sustainable manner. So if you look at, say, Cambodia, there's an ongoing integration strategy for community volunteer and health workers, yet village malaria workers, I think I'm getting that name right, are not necessarily included yet in that integration strategy. And we're going to have to focus on that in order to improve that. If you look at Laos, for example, community health workers and village health workers proved their worth during the COVID epidemic, where despite the severe lockdowns, they were still critical to being able to provide services, demonstrating in many ways their value added. And then you have positive examples where, say in Myanmar and Thailand, in Myanmar, we've seen a trend in the increased integration of the integrated community malaria volunteers in providing services, not just for malaria, but for other diseases that are affecting communities. And in Thailand, we've seen a lot of progress on gradual and strategic integration of overall malaria services, including health workers, into the broader health system. So I mention that not because it's the only example where we need to focus, but really is a critical one. And then finally, I just want to hit on sustainability planning. When I often talk about this, it sounds quite cliche or quite simple, but where we've seen significant progress, sustainability challenges, it has often been in places where there have been robust, nationally owned, strong conversations about sustainability planning. And in this region, that's already happening in many ways because of the great work of APALMA, of UCSF, and with the application of the MEI toolkit. So for example, in Thailand, in Cambodia, and Vietnam, there have been significant efforts to conduct sustainability planning, assess the types of challenges that exist at the national level. And I think we have a really strategic opportunity in 2023, 2025 to build on those. Sustainability planning is really just the beginning. The key is thinking about what the sustainability challenges are, and then building a national conversation around how we address those. Again, that's going to look different at the country level. It could be focused on, say, budget advocacy, because we need more subnational resources for malaria programs. It could be focused on moving forward with integration plans around community health workers. It could be about procurement inefficiencies. But the sustainability planning that has been conducted thus far is really something that I think we need to build on in this next cycle, bringing all the ministries together and communities and civil societies in a coordinated approach. So where I'll end is just to say, as a reminder, that the Global Fund has guidance on these themes that could be helpful for national programs as you dive into these themes. Our guidance note, which was supported by UCSF, has a malaria-specific annex that dives into 6 of the thematic areas that are often the most challenging when it comes to sustainability. And our funding requests, which many countries will be filling out, and many national programs will be supporting in the next 6 to 12 months, have maintained a really strong focus on sustainability, domestic financing, resource mobilization. So I hope both of these things can really help us double down on the important conversations that have already happened in the region to keep the progress towards sustainability of the national responses going. Angela, I'm going to stop there. I look forward, I know there's a lot of speakers to come. I look forward to the Q&A a little bit later.
Great. Thank you so much, Matthew. Next, we'll have Vanessa Elias, who is Program Manager at the Malaria Elimination Initiative, Institute for Global Health Sciences, UCSF. She's part of the MEI's Advocacy, Financing, and Sustainability team, supporting malaria endemic countries in accelerating domestic financing and preparedness to transitions from donor financing. In this role, she provides direct technical assistance and capacity building on donor transitions in countries in the Asia-Pacific and Africa. Vanessa, over to you.
Great, thank you so much, Angel, and good afternoon, everyone. My name is Vanessa Elias. I work with the University of California, San Francisco Malaria Elimination Initiative. It's a pleasure to be with you today and share some of our experience working with countries in the Greater Mekong subregion as they work to pursue sustainable malaria programs in the context of declining malaria donor financing. So I'll be sharing experience working as part of the Advocacy, Financing, and Sustainability team of MEI and our partnership in working with the national malaria programs, specifically those of Cambodia, Vietnam, and Thailand. So during my very brief presentation, I'd like to take the opportunity to discuss the following key areas. One being a brief overview of the importance of this topic and the work that countries are putting in to ensure the sustainability in their malaria. I'd also like to discuss our work at UCSF MEI in sustainability, and specifically the sustainability model, as we call it, when referring to the support we're giving countries in donor transition preparedness and malaria budget. And finally, a very brief overview of the current country engagements that we're supporting with APME. So as Matt mentioned, over the last 10 years, we've really seen unprecedented levels of external malaria financing from donor sources, which has really helped to strengthen vertical disease response programs in malaria endemic countries. However, donor funding has plateaued in recent years, and it's unclear whether these external resource flows will be sustained at current levels, or if we'll see a decline in the near to midterm. So as countries are also experiencing this economic growth and burden and achieving malaria elimination, they'll experience decline or even the end of malaria donor financing. So a clear example of this we're seeing is in the next RI funding allocation, where we're seeing potential reductions across the board. We could see a 55% decrease in the funding for Vietnam, nearly a 27% reduction in Thailand, a 24% reduction in Cambodia. And so that really makes this topic of sustainability something that's more relevant than ever. So what is it exactly that we mean when we talk about sustainability? Our definition that we use comes from the Global Fund, from the Sustainability Transition and Co-Financing Guidance Note. And it states that sustainability is the ability of a health program or a country to maintain and scale up the service coverage level in line with the epidemiological context that'll provide continuing control of a public health problem for supports for elimination. And this is even after funding from the Global Fund or any other external financing contributor comes to an end. So in order to achieve this, it requires significant planning and planning time of this transition, as donor transition has the potential to disrupt essential programmatic activities and can really undermine the progress towards elimination. So as donor transitions can pose this challenge response, we really want to think of all the different dimensions of programmatic sustainability. And we really see this as being a multi-dimensional topic. Include, for instance, disruptions to the health workforce, changes in data and surveillance systems, or the need to further integrate these data systems, changes in the supply chain and procurement of malaria commodities, programmatic governance and management changes in HR, and perhaps changes in the level of political will in an area, as maybe malaria is not receiving as much attention as other priority disease areas. So it's important to consider all these diverse factors when considering how to reach this definition of sustainability that we discussed earlier. So what do we do at UCSF MEI to try to help in this area? And so with the support of the Bill and Melinda Gates Foundation, our team, the Advocacy, Financing, and Sustainability team, has developed unique and specialized skills and approaches to support malaria endemic countries in accelerating domestic financing and preparedness to transition from donor financing. MEI has provided direct technical assistance and capacity building on donor transitions and budget advocacy through this MEI sustainability model in several countries in the Asia Pacific since 2017. And our sustainability model really includes two approaches, the first being malaria donor transitions, and that's where we work to build country preparedness to transition from donor to domestically financed programs, as well as malaria budget advocacy, where we work to strengthen from malaria through subnational leadership and advocacy. And these can occur, simultaneously, or there are instances where we've done, one and not the other, but both with this aim of supporting countries and building really resilient systems and a malaria response that works towards elimination and works towards the prevention of reestablishment. So since 2017, we've had a really wonderful opportunity to work kind of across the globe. Most recently with APME, we're working in Thailand on malaria budget advocacy, transitions assessment and integration research. We additionally are working with the National Malaria Programs of Cambodia and Vietnam, where we have finalized the transitions assessment and are moving kind of in our next phase of work. Most recently, and financed by the Global Fund, we've had the opportunity to conduct a transitions assessment and a plan in East Watini. So, we're very passionate and keen to continue this work. And should you find, this useful malaria program, we'd be very interested in partnering with you. And please don't hesitate to reach out to myself or someone on the team. So to carry out this, two tools that we use to help guide countries. The first being the Sustainability and Transitions Readiness Assessment Tool for Malaria, and we refer to this as SUSTAIN. And the second is the Malaria Budget Advocacy Framework. The SUSTAIN tool is an assessment and planning tool for guiding malaria programs through the process of preparing for the sustainable transition from donor support. And the MBA framework was really designed to address kind of the gaps in facilitating a multi-stakeholder process to develop an advocacy strategy for malaria. And so this is while strengthening the capacity at a subnational and even national level for leaders to access, to mobilize, and to manage this domestic financing through advocacy and leadership. So just a bit more detail. So, the purpose of SUSTAIN really is to help national malaria programs as well as their funders and other partners, to identify and address some of these needs as country prepares for the end support from malaria. And it's really the first step in the transition planning process. So we work to generate evidence that can be used for countries to develop these sustainability and transitions plans. So it is really a multi-stakeholder process. It involves, all individuals involved in the malaria response in the country. And we work together to prioritize strategies and actions for this transition period. As such, SUSTAIN focuses on dialogue and facilitating priority setting and problem solving across these key different stakeholders, both at the national and subnational level. This is a really essential component of sustainability and transitions planning. A bit more detail about the Malaria Budget Advocacy Framework. So it's really a process by which we, assist programs in planning and executing strategies. It encompasses 5 modules. So situational analysis, advocacy and strategy development, capacity strengthening, strategy implementation, and monitoring and evaluation. And this framework is really intended to be used by programs and by subnational malaria teams and provincial or regional health officials who are interested in engaging in malaria budget advocacy and are interested in collaborating with relevant partners to create this advocacy document. So this is kind of how we, I think Matt did a really important job of kind of outlining why this work is so important. And so, we understand well that the risks that come with the decline of funding and political will to malaria programs and kind of these potential disruptions in the health workforce or data and surveillance systems. And we really see this, sustainability model as a solution, as a health systems approach to malaria sustainability with the ability to help secure other sources of sustainable financing, to help allocate the efficiency of resources and to build upon, political commitment or capacities already existing, and to really embed some of the critical malaria. And the impact or what success looks like for us is if malaria response is prioritized by the country and efficiency in the health system, for the creation of a sustainable response with no resurgence or reinduction of malaria. So our work to date, we have had the opportunity to work with the national malaria programs of Cambodia and Vietnam very recently. These are 2 documents that I think Angel is going to share if you're interested. And I think this will kind of contextualize the work that has been conducted in these assessments. So both of these use the SUSTAIN tool as a guiding document, but they really highlight the specific challenges within these health system domains to sustainability. And it's really allowed us work as kind of a first evidence generating document to, in creation of the next phase of work, which is planning. So this is one pathway that I think countries can take in their kind of process of becoming a more sustainable malaria response, and in working with us. So in 2020 and 2021, scoping phase and conducted this donor transitions assessment and a situational analysis for the development of malaria budget advocacy strategy. And from 2022 to 2023 onwards, that partnership continues, and we're really proud to work with APMA as well as CHAI as our implementing partner and the national malaria programs to together develop some sort of roadmap for transitions planning, which will include the specific steps, responsibilities, and timelines of what needs to happen over the course of the next, looking long-term sustainability, so up to 10 years perhaps. Meeting this Global Fund TRP requirement for the grants and really generating this multi-sectoral whole of government support where the conversation of malaria sustainability isn't resting only within the national malaria programs, but also, the ministries of finance and planning and budget or other relevant ministries that are outside the malaria, but are very much affected by this topic. From that phase as sustainability is certainly a long-term process and goal. We look at implementing some of these roadmaps and creating additional advocacy, capacity building, identify policy solutions that might be needed for perhaps health product management or for surveillance or other areas that come up, and this scaling up of such strategies. Just to mention very briefly that in Thailand, we've taken a bit of a different but very interesting approach. We as well conducted a donor transitions readiness assessment where they really highlighted some key areas in HR and in integration that they would like to pursue. And from that, we've kind of developed evidence-based guidance from the evidence that was generated from the assessment, where the DVBD of Thailand really wanted to look at the integration of the malaria program into the larger health system. So we therefore help to assist the development of guidelines for integration at the national level, in addition pilot and the assessment of these integration guidelines in selected provinces. So just to mention that, that there can be some evidence generating activities in the sustainability process that we have been supporting and carrying out as well. So that is it for me, but thank you very much. And we're very pleased to share our work in supporting countries in the GMS. So thank you, Angel.
Thank you so much, Vanessa. Just a reminder that question and answers will be at the end. So if you have questions for any of the speakers that have already gone, please feel free to put them in the Q&A chat box and we'll address them together as a whole after all the presenters have gone. Next up, we're going to be having Dr. Pubudu Chulasiri and Dr. Nesmini Tenuwera, who are both consultant community physicians at the anti-malaria campaign of Sri Lanka. Dr. Pubudu is currently in charge of case management, follow-up, and management of drugs, while Dr. Nesmini is in charge of surveillance, monitoring, and evaluation. They both bring substantial experience from various departments across the Ministry of Health at the national and subnational level, and we're honored to be hearing from them both today. Dr. Pubudu, over to you.
Yes. Thank you, Angel, and thank you, APMENxChange, for inviting us to present our experience in Sri Lankan setting in sustaining malaria responses this beyond elimination. So I am Pubudu, and I'll be mainly in the first few slides, I'll be presenting some finding and facts before the elimination, and Dr. Nethmini will present the findings and these experiences even after the elimination. So good morning, all of you, and good afternoon and good evening. Sri Lanka has a very huge success story of malaria in Sri Lanka. Although we suffered malaria for few centuries, according to this, from the beginning of this century, from 2000, you can see that there is a huge reduction of number of malaria cases from 1999 to 2012, almost from 264,000 to 23 cases within 14 years. So it was a great success. And even the deaths, there were 102 deaths. 2007, we got the last malaria deaths. So after that, we could prevent almost all the deaths of malaria. So because of that, with this huge success and with 0 cases since October 2012, WHO issued a certification as a malaria-free country in 2016. So although we are not having indigenous cases since we are having imported cases, around 40 to 50 cases in each year. And we had an introduced case in 2008, transfusion-induced case in 2021. So in 2022 also, we had 37 imported malaria cases from African region. You see this graph. This shows our number of cases from 1911 to 12. You can see that we had we could achieve the elimination. Even in 1963, we achieved near elimination status. And we had only 17 cases, but with some mistakes done by the Sri Lankan government, especially focusing out of the funding and the transition. Some of the staff of the campaign, there was a huge outbreak started from 1967, and it extended for about 40 years to achieve this elimination in 2012. And other than that, there was a 30-year-long war conflict that we suffered a lot, and it also disturbed our activities in some extent. But even though these restriction disturbs within this 30 year, we had a huge financial as well as technical assistance from several international and the local agencies, especially the World Bank and the World Health Organization, and especially from 2003, GFATM project. And from the GFATM project, they actually supported us, not only financially, and as well as technically even, especially regarding the surveillance, to streamline the surveillance and the follow-ups, and all of these were supported by the GFATM project. These assistance and these financial and technical support given by these agencies, we could achieve our target in 2012, the 0 cases of indigenous malaria cases. Not only this financial and technical support, we had a very committed staff in the anti-malaria campaign. So their commitment led us to have this malaria elimination in a rapid journey to achieve in 2012. Other than that, we had very good and efficient case-based surveillance and response system, which was, we had individual case surveillance. We started individual case-based surveillance and this parasitological and entomological surveillance. So the very efficient surveillance led us to achieve our target. And rather than going for the blindly, the vector, especially the vector control activities, we just had selective vector control activities, especially IRS and this chemical larviciding. We could achieve less insecticide resistance even. That because that caused us to have some kind of efficient this vector control and this application of other. And the other way, we had very good health awareness because the people in Sri Lanka, they are more aware on this especially malaria. Health awareness on prophylaxis and other diagnosis, we could achieve increase number of participants coming for the treatment, the patients coming for the treatment, and we could increase their follow-up rates. And we had very good community engagement programs, especially happened in Sri Lanka, especially the Sarvodaya and TADA and other agencies. Regarding the cost of program, in 2014, we just estimated, actually this journal, Sri Lanka authors, they estimated the costing to keep the program itself. After 2014, they it, and they found it that to keep the program itself as it is, only 0.57 US dollars per capita per year is spent, and especially regarding the financial cost, only 0.37 US dollars per capita is needed. But in case of potential malaria resurgence occur, then it will be 13 times higher of cost to maintain these existing activities, and it will be 20 times higher, especially for the financial cost. So this shows us to keeping the malaria-free status, to keeping the malaria status as it is, and to keep the malaria activities as it is, to maintain this free status is very, very vital in regard of the financial perspective. So before the elimination also, even though we could achieve 0 cases in 2012, you can see that there was a huge and government and as well as from the global fund financially to the malaria control programs, and even that led us to keep the malaria free status until now, almost 6 hours after the elimination. What happens if we stop it? If we purposefully stop these activities, the malaria control activities, even after the elimination? We have several examples in Sri Lanka, as I told earlier, countries also that says that if we purposefully stop our activities at the stage of elimination or even after the elimination, there will be huge resurgences of malaria. Malaria. So, and you can see that in the graph it shows from 1949 to 1963, there was a huge reduction of number of cases. But with this government, some kind of mistakes done by the government at that time, there was a huge outbreaks of malaria, lasted for 14 years. Are we following the same path? Yes, you can see in the dark brown graph, you can see we are in the path of this same pattern. That means history repeats itself. So if we don't keep our activities as it is, if we don't sustain our activities as it is, we will be having any outbreak at any time in Sri Lanka. So the keeping the sustaining these activities even in the future, even after the elimination, is most vital. So the malaria responses beyond elimination will be discussed by the Dr. Nithmini Tenura. Dr. Nithmini, it's over to you.
Oh, good evening, good morning, good afternoon, everyone. Nice to share Sri Lankan experience with you all. So it's very important to sustain malaria-free status after achieving the elimination by vigorous and dedicated efforts. To sustain elimination status, we have worked hard in line with the National Strategic Plan, which was developed in 2018 following the elimination. So there are 6 major areas of work. So the early diagnosis and prompt treatment is essential to prevent complications and transmission of malaria. As all of us know, quality assurance is really important in this diagnostic area, and we are maintaining the WHO standards in our diagnostics. Then parasitological and entomological surveillance is one of the core interventions in the elimination phase. Malaria prevention is done by activities such as offering chemoprophylaxis, rational vector control. As earlier we heard, the insecticide resistance monitoring is also very important, because if there's a resurgence, we should be capable of using the insecticides available with us. So mobilizing the community and the commitment of the politicians and other parties, this advocacy and community participation is also really crucial. Then activities related to governance and policy will enhance the sustaining of malaria-free status in Sri Lanka. Monitoring, we have a strong monitoring and evaluation system. So it's identified as one of the main areas in our strategic plan. Actually, now we are in the process of developing the new strategic plan. So accordingly, we are thinking the ways which are the main areas of work that we have to focus on. So we have been receiving the budget support from Global Fund until 2019. Then during years 2020 and 2021, it was given as a reimbursement. We have to spend our government funds, and then the Global Fund reimburse our expenses. So they have put the mainly 4 tracking measures. So in a way, that's good. So unless we achieve those tracking measures, unless we fulfill those needs, receive the funds. So those are mainly on procurement of essential anti-malarial drugs and commodities and development of our guidelines, then midterm review of this, development of the human resource plan beyond elimination. So we were able to achieve the A rating, the excellent performance in our performance of the anti-malaria campaign, and received all the funds during past years, 2020 and 2021. Then when we see the government spending at national and regional level, next slide. When we see the government spending, this is from the Central Bank report of Sri Lanka. The spending is more or less same during the past few years. So due to COVID pandemic, there are some interruption to the activities, and as we are getting only imported cases of malaria, the traveling has been to a very low numbers. So the funding is more or less the same, but you can see the World Health Organization has increased their funding to the malaria control program in Sri Lanka. So initially they have been giving us mainly the technical support, but lately in 2022, they mainly contributed for the procurement of anti-malarial medicines and prophylaxis drugs, and also for other commodities. In recent years, we are seeking the donor funds from UNHRC, International Organization of Migration, Rotary, regional level, local level organizations. So to sustain the financial stability, anti-malaria campaign of Sri Lanka has taken many steps and innovative approaches. So we have conducted a social media campaign. It's a Facebook post and YouTube video competition among the health staff. So to make the health staff aware on malaria, because since elimination, as we are not seeing so many patients, the people might forget malaria as a differential diagnosis. So we were able to achieve the high coverage with the low cost and within a short period. So in this program, health staff as well as the public were made aware on malaria. In the media, social media, and electronic and printed media with free of charge. Then we have thought of integration at regional level, though we are having, that's a good point, showing the commitment of the government, because after elimination, the national level focal point anti-malaria campaign has not been dissolved. So we are having a national level strong focal point, but regional level, in some regions, we have integrated vector surveillance and management into the other vector-borne disease control programs. So we have been strengthening WHO-funded activities, and local WHO country office and CRO are supporting very much for this. and we are seeking new donor funds for the coming years also. So some activities have been reoriented, such as compared to the community mobile clinics, we have been doing fever surveillance in the community before elimination phase. Now we are more focusing on hospital fever surveillance. And these some who are going abroad will go into the private sector, and we have strengthened the fever surveillance in the private sector as well. And surveillance of high-risk groups are also very important. And entomological surveillance activities have been coupled with the importation risk. So we are limiting the number of surveillance activities and prioritizing the essential activities only. Strengthening surveillance of migrant flow is enhanced by the intersectoral collaboration, such as we are having good communication with the Ministry of Defense as they are sending soldiers for peacekeeping missions in African region, and then gem traders who are traveling for Madagascar and so many other countries for gem business, maybe shipping companies and travel agents and so on. So due to that, we have to thank the COVID pandemic, more people are being used to online facilities. So we have been conducting and using online platforms for meetings rather than getting all the people physically like previously. So it also reduces the cost, and whenever it's essential, we gather people and conduct the meetings. So then we have ensured availability of effective and high quality medicines in all regions. So from that, we were able to, whenever diagnosis is made, the medicines are available within half an hour's time at each institution in Sri Lanka. Then we are conducting continuous knowledge updating for clinicians in the private sector and the GP setting. Then our main pillar is the strong monitoring of malaria control activities. We are having monthly review meetings with all regional staff, and we are having a good supervision system. And having a 24/7 hotline with internet facilities, people, even if they are abroad, to contact our health staff, our medical officers are answering, and then the problems are resolved then and there. So thank you so much. These are the main activities that created to sustain financing, to reduce the cost of the current program and enhance mobilizing donor funds and the government funds. Thank you so much.
Thank you so much, Dr. Nathmini, and thank you so much, Dr. Pubudu, as well. It's really interesting to hear about Sri Lanka's experience, both on the elimination and sustainability journey, as well as the real threat and cost of resurgence if sustainability is not planned for well. So very grateful for your sharing. Next up, we'll have Dr. Jose Gerard Belimac, who is currently Officer in Charge, Director 3, Strategies and Standards at the Disease Prevention and Control Bureau of the Philippines. Early in his work, he was designated as the National HIV and AIDS Program Manager, for which he facilitated development of policies and programs that accelerated access to prevention, diagnosis, and treatment of HIV and hepatitis. In 2022, Dr. Belimac was appointed as Chief of Infectious Diseases Division, where he chaired all 3 technical working groups of HIV, AIDS, and tuberculosis for Global Fund grants. He's also active in development of the new funding model proposals for submission to the Global Fund. Dr. Belimac, over to you. You're on mute.
Sorry.
Great.
Good morning, good afternoon, and good evening to everyone, those who are attending this meeting. My presentation today will be on the current works of the Philippine Department of Health on achieving the universal health care and the malaria elimination, and what does its implication to malaria elimination. Before I start my presentation, I would like to share to everyone that for the midterm goal of the health, our focus is to make Filipinos healthier in terms of better, more equitable health outcomes, responsive health systems, and improved financial risk protection through its strategic thrusts. Our four strategic thrusts include enable Philippines. This is in recognition that improving health and achieving health equity will require broader approaches that address social, economic, and environmental factors that influence health. Second pillar is to protect from all health risks. This is to make our health systems capacity for recovery and adaptation to future disasters and pandemic. And third is care for Filipinos' health and wellness. This is to give greater attention to health system design, financing mechanisms, and the process of care in accordance to the reforms espoused under our Universal Healthcare Act to deliver people-centered care for health and wellness. And cutting across these three strategies, we also need to strengthen our health institutions and workforce, wherein all public health institutions in charge of health are right-sized and are efficient, and its workforce are adequate and engaged. For each strategic thrust, we have identified strategic objectives that define the transformation that we envision. So for enable pillar, we will, we acknowledge that our health outcomes do not solely rely on the quality of the health services that we are providing. As a matter of fact, in our setting, majority of the interaction of the person to the community, to the schools and the workplaces would influence the health outcomes of our Filipino citizens, and only 20% of the health outcomes is being attributed to the quality of the service that a person is accessing. And secondly, is our central office would continuously provide support, guidance to our local government units, as our health system is purely decentralized. So we are providing different tools and manuals to our local government units for them to be able to deliver the priority programs that the national DOH has identified. And one example to this is the continuation of our support towards improving knowledge of the general public on malaria. So we have different issuances as well as information materials that are being given to our local government units. And again, in our enabling strategy, it is important that we need to address the environmental health issues that are cross-cutting and affect the vector-borne diseases in our country. Under the Universal Healthcare Act, wherein we are really trying to pursue for the next medium term, or at least for the next 5 years, we are really compelled to integrate our work streams in the Department of Health. The integration would happen at the financial aspect, at the program, as well as at the technical aspect of program implementation. And we have tried, and we have ongoing activities that shift programmatic approaches to integrated approaches. The integration in terms of policy development, in terms of planning, and also the development of standards of care for the delivery of health and health-related services. So the universal healthcare framework sets a clear approach to care through integrated provider network with primary care provider as the navigator. Under our universal healthcare, we are designing a program such that at the entry of the Filipino or the client or the patient in our health system, comprehensive services are being provided based on life. So we have now an omnibus health guidelines that defines the services that are needed for the different life stages from pregnancy to the elderly stage. Under our universal healthcare, surveillance is at the forefront as basis for our program and policy preparation. So you see in this slide that malaria is continuously being surveilled under our epidemiology bureau. Again, for the point of integration, our malaria is being integrated now in one, and it's being handled by a subgroup that specializes on diseases for elimination and vector-borne diseases team. So as part of the work of the subgroup that addresses diseases for elimination, we have started our workshop to develop our first multi-disease elimination plan, and we hope and we will work that this multi-disease elimination plan would become available in country within the year. We have also prepared in terms of the new funding model for the global fund. We have also prepared our malaria elimination subplan. The malaria elimination subplan started with a process of conducting a transition readiness assessment, from where we developed our operational plan for transition. And again, for our integrative work, the malaria elimination subplan will be embedded or integrated into a much broader multi-disease elimination plan. As mentioned, during our planning exercises with the local government units and the stakeholders, we have already identified the co-financing landscape or scenarios with the national program, the local health department, as well as the global fund as major key players in the elimination of malaria in our country. And you will see here that we will continuously work together with our stakeholders that domestic financing would be increased through time. For the ways forward of the Department of Health in addressing our malaria problem in the country, we shall finalize our Department of elimination plan. We need to capacitate all the local government units to ensure maintenance of malaria-free status through case and vector surveillance and response strategies, and strengthen our partnerships with the private healthcare providers, where almost all internationally imported cases are seen and managed. And lastly, the government shall ensure the availability of quality anti-malarial drugs, including second-line drugs, even in our malaria-free areas. So I guess that wraps up my presentation, and thank you very much for this opportunity to share in this meeting.
Thank you so much, Dr. Bellimac, for sharing the Philippines journey, in terms of integrating the different elements, as well as integrating malaria as part of the broader UHC kind of thinking for the health system. I think we've now come to the time of Q&A, where we'll have all speakers come back on. So I would appreciate all the speakers turn their cameras back on so we can see all of you. I know several people have already posted questions in the chat, and some of them I wanted to call out a few specific questions. Feel free to keep the questions coming, and I'll try to read them as quickly as possible and bring them up. But I thought the first question by Robert that was posted at the start of this webinar was a really relevant one. I know it's initially directed to Matthew from the Global Fund, but I thought the question would be applicable to the country programs represented here as well. I'll read it out. And the question is, talked about how ever since the inception of RBM in 1998, the focus has been on promoting malaria elimination efforts and strengthening health services. Other sectors, including agriculture, energy, transport, and trade, have a major impact on malaria and programs, and they often have access to a lot of funding for infrastructure, for example. Yet when you talk about sustainability and resilience, it continues to focus exclusively on the health sector and health systems. Is there any consideration given to invest in supporting and catalyzing the role of other sectors in prevention, control, and indeed protecting the achieved elimination? I wonder from Sri Lanka and the Philippines, perhaps if you have examples of cross-sectoral, intersectoral collaboration beyond the health sector that you could share with the audience here. I think it's definitely a very important point indeed. And I think a question that was directed later on mentioned the example of, or I think in Matt's response, he mentioned the Ministry of Education being an important ministry to engage on health promotion, health education. And I'm sure there are other examples as well, but it'll be interesting to hear from, Sri Lanka, your program, or the Philippines. Yeah, Dr. Balimac, over to you.
Yeah, thank you very much for that question, and thank you, Ange. I guess one thing that I would like to point out with our experience in malaria is the engagement of the private sector in our response. Now, we have a very proactive private sector that is now also the principal recipient. But even before they became the principal recipient in the country, they had already big and tremendous efforts to address malaria in fact in the high burden province in the country. They tried to help the government in addressing this malaria because it is where their critical office is located, and they know that if their employees get sick with malaria, their operations will be affected. And so I guess the important lesson there is really to keep on educating and sharing and capacitating our partners on malaria elimination so that they will be able to situate themselves in the response and in the prevention and control and elimination of this disease. Thank you.
Thank you so much, Dr. Balimac. Dr. Nesmedian. Oh, I don't think we can break out. Right.
Sri Lankan experience, we have a good collaboration with the Ministry of Defense because earlier we were getting a high number of imported malaria cases from the army persons who are going to African region for peacekeeping missions. So then we collaborated with the Minister of Defense, and now we are having monthly review meetings with them, and we are issuing prophylaxis before they are leaving the country and giving health education. And then we are training their MLTs who are working in the hospitals in those countries to detect malaria. And we are providing anti-malarials free of charge to treat them completely and get a complete cure rather than half a treatment. And then as we are having good collaboration, we are able to follow them up. We are preparing WhatsApp groups whenever they return to the country, and then in each region we are asking our district officers to follow them up, screen, and then whenever they develop symptoms also they call us, they come to us and get the screening done. So we are having a good collaboration with them.
Yeah, other than that, I think we will be getting very huge support from the International Organization of Migration, IOM, and because whenever there will be when there are refugees coming through them, what they do is they help us to follow them, and they help us to trace them, and when until they will be get embarked to the other countries, we will be following them up. And if needed, if they are having some symptoms of malaria as imported cases, we will be treating them. So we will be having a very good collaboration with the IOM and the other UNHCR as well. Yeah.
Thank you so much, Dr. Nesmedi and Dr. Pururu. I think, definitely involving the different ministries, including National Defense, as well as the different cross-border authorities would make, a definite difference with cases, potential imported cases. Yeah, thank you so much for your sharing. Moving on to additional questions. I'm seeing questions really roll in. I think there are a total of 17 questions. So please upvote questions that you're more interested to hear in, then I'll be more likely to call on them next. But the next question I wanted to bring up was a question by Angela Devine. It was initially for Matthew, but I think this is applicable to all the speakers here as well. The question is, what methods are used to encourage low-income countries with a low burden of malaria to prioritize malaria control programs over other health issues that cause a higher burden of disease? So perhaps Matthew, from your perspective, or Vanessa as well, but we'll also love to hear from the Philippines and Sri Lanka if you've had any success in terms of how do you advocate for prioritizing malaria, even if there are other diseases, with a higher disease burden.
Angela, I mean, I can very briefly respond, but very interested in the responses of others. I mean, I think I would say this: I don't think it's a question of prioritizing over other diseases. Clearly, what we all care about is getting good quality health services to people who need them, regardless of the disease. I would say, I think, this is really about how we provide comprehensive packages of services and leverage the investments in the health system in order to not just provide malaria services, but provide others. So directly to the idea of integrated health services, the way in which we can provide all the services we need at the facility level, at the community level. So I think we've got to think more from an advocacy standpoint. Keeping the malaria on the agenda, even in low burden contexts, is critical. We've seen so many examples. I don't need to of people where we've seen resurgence, where we've taken our eye off the ball, where we've had significant progress in terms of control, moving toward elimination, and then moved away from malaria control efforts and seen it rebound so that the burden of disease actually increases. So I think it's both a combination of more of a comprehensive approach to providing all the health services that's needed, including malaria, and as well making sure we continue discussions at the national level about the fact that resurgence can happen, and it can happen really quickly, even in low burden contexts. But I'd be very interested to hear things.
Yeah, it'd be interesting to hear from the specific country examples, but just to say that I think that the malaria budget advocacy framework really strives to do exactly that. As a priority for countries, really at the subnational level, and that could be selecting, both a high or low burden province or district that has the opportunity to engage key stakeholders and to encourage that we're not taking our eye off the ball as we're inching closer towards elimination or even surpassing malaria elimination, and really understanding that this is a long-term objective and fight, and that advocacy has to be continued in order to sustain those gains. We've seen really interesting, I think, financing mechanisms and malaria councils and malaria funds that also have contributed to keeping malaria very relevant at a political level, both nationally and subnationally, which I think is really helpful in kind of that advocacy for the program outside of the malaria program. And so those would be kind of my suggestions.
Yes, Angel, can I respond for that?
Yes, certainly.
After the nation, as Matthew, we don't have this disease is more prior, and this should be more prioritized like this. We didn't put that into this table, but we did know that there are several campaigns that in Sri Lanka, dengue control unit, anti-filaria campaign, anti-malaria campaign. So we are now having some kind of integrated approach, because in these campaigns also the staff is expert in other diseases as well, vector-borne diseases as well. So what we do is we just integrate these staff and we do the activities together. Suppose in some regions in Sri Lanka, both dengue and filaria and malaria, it's been the vector is there. So what we do is we ask them to do these programs with integrated, and whenever they find the malaria vectors and others, if suppose the person in dengue control unit finds some vectors on malaria, they informed us regarding those things, and they asked to get the do some vector control activities as well. So this kind of integration we are having now. Then our staff number of staff is low now, and this from the financial side also we need less money to do these things, as we need a few staff for these activities. So I think that kind of integration is happening now in Sri Lanka as well. Dr. Nedmini, you
with integration, we are also clearly thinking about sustaining the skills of the health workforce also. So we have to train earlier the people have been trained for a particular disease entity. So now we have to train everyone, and we are thinking how can we do it, whether the maybe entomology is more or less same. So like that, even for parasitology also, with the staff of filariasis campaign are doing the malaria activities, our field staff. So we have to keep it sustained. As Matthews mentioned, we take the higher officials about the resurgence. If even though the burden is low, there might be a resurgence of malaria, and then it will become another high burden disease. So we take that point forward very to convince the higher authorities.
Yeah, definitely hearing the common theme of integration, being key. Dr. Anything to add from the Philippines as well?
I think one important thing here is really sustain the capacity of the local health systems to detect and area. For now, still trying to improve on our elimination hubs. These are subnational teams that address the integrated diseases for elimination, lymphatic filariasis, and malaria, including rabies. And so this team at the province level would continuously capacitate the local government units in terms of responding to any case of LF and malaria. So this is one thing that I'm sharing. Thank you.
Wow, that's really interesting to hear. I think at APMA, we're also seeing, quite a few of these integration of vector-borne diseases and surveillance on this as a key part of sustainability as well. So very, very interesting to hear that this is also ongoing in the Philippines and Sri Lanka. We have also quite a few other questions. One more question I thought was interesting as well as kind of the role of the private sector. I think it was directed to Dr. Bellimac, but would be interesting to hear from Sri Lanka or any experiences that Vanessa or Matthew would like to share as well. But this is from Andrew Saibu, and his question is, thanks for the presentation. I'll be happy if you could share a little bit more detail about the role the private sector played. We're working with some countries to strengthen the role of the private sector, and vector control in Africa. We'll be happy to pick some lessons and tailor them to meet specific country needs.
In Sri Lanka, mainly the private sector contributes to the diagnosis and management of the patients. Though from the Ministry of Health, we are issuing all the medicines free of charge, but most of these persons who are traveling abroad are in the high income level, and compared to the past, they tend to admit in the private sector. So it's very essential that we need the support of the private sector. So we are still in some regions, it's happening very well, the screening in the private sector, but not as equal in all the regions. So it's a crucial point, and there are the different staff categories in the private sector: medical laboratory technicians and the microscopist, we are having public health laboratory technicians. That category is not there in the private sector. So then the parasitologist is training these lab technicians in the private sector to detect malaria. And as we are having a hotline and a good collaboration, sector in all regions, sometimes they inform us whenever they suspect a person with malaria. So mainly for the diagnosis and for the treatment, when we are managing patients of malaria, but the private sector consultants, they are supporting us and they are allowing us to manage their own patients. So it has to be there, as we cannot ask them to get admitted at the government sector. So even for the foreigners, we are giving treatment free of charge, and some of the shipping lines, whenever they detect a patient with malaria, they embark on Sri Lanka and then hand over to the our health system. So it's happening like that.
Yeah, and on the other way around, the entomology part and the vector control part is completely managed by the government because of undue usage of chemicals and other things, and the government has capacity to do that. So the entomology part and the vector control part is managed by our Ministry of Health. It has not been given to the private sector so far.
Yeah, I would like to add, Ange, on the private sector in response to the comment at the chat box. Now, I'm afraid I would be overrepresenting the private sector in this case, but I guess it is okay if the interested party will also connect with the Philippines Shell Foundation, whom I am referring to as an active provider, so that they will have a direct information how the Filipino Shell Foundation complemented the activities of the local government unit. Thank you.
Yeah, thank you, Dr. Bellimer. Actually, Vanessa, I think perhaps you might know a little bit about the Philippines. I know that the Shell Foundation had worked closely with UCSF previously on malaria budget advocacy as well. If there's anything on that front you might want to share about their private sector contribution.
No, I don't have anything specific on their private sector engagement. I know that's something that came out that was, really essential and in some sort of advocacy plan that they would like to take forward, but I'm not sure where that's at right now.
I see. No worries. No worries. Thank you. Thank you so much. I'm trying to look through the questions list to see if there are any additional ones that we could address as part of this webinar. There's one more integration as well, I think specific to seeing how maybe responses to HIV, TB, and malaria were integrated, from the point of view of, there's a question from Prudence Hamade, from the point of view of systems depends on funding not only for malaria, but also HIV and TB. These programs are often vertical. Is any effort being made within MOH to integrate interventions across the and also funding sources for maternal and child health? I thought this might be an interesting question to address from the RSSH perspective. I know comes with an RSSH component, that really encourages spending not just on a vertical disease program, but on health system strengthening programs that can benefit all three diseases. I'm not sure if Matthew, you might have anything else to add on this front, or if any of the programs as well would want to add.
Thanks, Sandra. I think from my side, I would go back to what I emphasized when I spoke about co-financing. There's obviously and our approach to co-financing is a very disease-specific thing, and it's not. It's both a disease-specific thing as well as a health system thing. I mean, we need to work closely to really strengthen the overall financing of the health sector, without losing our attention on the specific or specific interventions. And so I think that's a really important thing to keep in mind, because both are going to be really challenging moving forward. On the vertical programs, I think that this is a conversation where we should just be honest. Entities like the Global Fund have been very supportive historically of national programs and national responses. And we've got the results to prove that that's been very. But when you think about sustainability, you have to ask really tough questions about whether that vertical funding is sustainable from a country perspective. And so some of the systems, some of the ways in which we've been able to support really strong reduction of malaria or control has been through somewhat parallel investments that are not likely to be sustained in the same way. And so we just need to be honest about that. In many ways, that helped us achieve really important short-term objectives, right? But as we think about the next step, as all of the panelists have talked, moving away from some of that vertical thinking, much more toward the integration, much more toward cross-sectoral financing, not just of a response, but of a health sector, of a facility, is really quite important. So those are the two comments I'd offer.
Thank you so much, Nathan. If anyone else would like to jump in as well. If not, I think we have time for one final question before we'll close out today. Does anyone want to add on the kind of the RS co-financing kind of elements? No, okay, cool. The final kind of to see which lucky question would make it into the final. I think there's a question here on on integrating activities at the subnational level. Ravindra Jayanetti had asked, it was initially directed to Dr. Pubudu. It is very important to integrate malaria POR activities at subnational levels at least. What actions have you taken to integrate activities such as tracking vulnerable groups, such as migrant workers at the grassroots level? And I know often, especially at the last mile, vulnerable groups are kind of have elevated importance to direct attention to. So I wonder if Dr. Pubudu, you
Yeah, Angel, yeah.
share any actions on this
Yeah.
front?
Actually, regarding this high risk groups, what we do is usually we have a separate staff, public care staff allocated to screen those people, because we have a small administrative areas like MOH area, we call MOH officer of health area. So in the staff of these areas, what they do is whenever they get to know that there are some people who have been to this endemic country and return to Sri Lanka, what they do is they just go there, meet them together and get the information and put into our register. And if there are some factories and other things where the people who came from these endemic countries, special the countries from India and the African region, sometimes they go to these factories and do the screening, and they find out that these people are there and they are at high risk. So what they do is they screen them, they follow them, and if they get any symptoms of malaria, what they do is they treat them. So other than that, there are lots of population in some areas, they go for the pilgrimage, especially to the India and the other Southeast Asian countries. So what they do is we have some collaboration with the agents who are responsible for these tours. So what we do is we have a close communication with these agents, and what do we do? Identify them before they go there, and we try to give prophylaxis for them to prevent from the malaria. So these are the subnational systems to identify these people I think we have so far we have succeeded, and we have covered a huge proportion of these people who are considered as high risk people.
I
Thank you.
see. Thank you so much, Dr. Pudu. That was really helpful. Yeah, I think we've come to the end of the time that was allocated for the webinar. It was very, very helpful to hear, from all your different perspectives on the subject of sustainability. I think particularly Matthew, very many thanks to you for sharing Global Fund's perspective, especially the sustainability co-financing and transitions policy. It's especially relevant given that I think Maxine also mentioned in the chat, in the GMS region, they're very much working on the funding proposal development for RIFE4E. I know the other country programs as well, working on their funding requests for their respective global fund allocations. Definitely a timely sharing from your end. And thank you so much, Vanessa, for sharing the MEI toolkit. The elimination toolkit was a sustained tool that has already supported several countries across the region and in Africa on their sustainability planning efforts. Thank you so much, Dr. Pubudu and Dr. Nathmini, hearing from you from the Sri Lankan perspective, the journey towards elimination, from elimination as well as sustainability, which carries on through today. Thank you also, Dr. Bellimac from the Philippines, sharing about the Philippines journey, integrating across different components as well, sharing malaria is included in the overall universal health coverage plans that the Philippines have for every Filipino. It was really great, insightful conversation we've had today. Thank you for sharing your perspectives during the question and answer session as well. Thank you for the many participants that shared the many questions. I know we missed a few questions. We didn't have time to cover all of them, but definitely encourage you to reach out to this after this, or for any follow-up questions. This will be up on YouTube as well for anyone who would like to direct it to any colleagues who might find this helpful. Before we close out today, I know my colleague had prepared a quick poll of just 3 questions for everyone to answer. So yeah, it's coming up right now. If you could just answer these 3 questions really quickly before you sign off, I'm grateful for your responses. But otherwise, thank you so much for everyone that took the time to participate today. It was wonderful to have you all join us. And we hope to see you again in our next webinar.
Thank you.
Thank you so much.
Thank you very much, Angel. And
Thank you very much.
Apalma and Atman.